Imagine you're sitting here enjoying your morning coffee. You feel perfectly fine, but inside your body, something dangerous might be happening. Silently, without symptoms. It's called high blood pressure, or hypertension, and it's one of the leading causes of heart disease, stroke, kidney failure, and even dementia. In fact, the CDC estimates that nearly half of adults in the United States, about 120 million people, have hypertension. But here's the shocking part. Most don't have it under control. Let's break it down simply. Blood pressure is the force of your blood pushing against the walls of your arteries. Think of your arteries like garden hoses. When water pressure is normal, the hose works fine. But if pressure gets too high, over time, the hose starts to wear out. That's exactly what happens in your body. Blood pressure is measured in two numbers. Systolic, top number, pressure when the heart beats. Diastolic, bottom number, pressure when the heart rests. According to the American Heart Association, normal is less than 120/80 mmHg. Elevated is 120 to 129 over less than 80 mmHg. Hypertension stage 1 is 130 to 139 over 80 to 89 mmHg. Hypertension stage 2 is 140 plus by 90 plus mmHg. Hypertensive crisis is 180 over 120 plus mmHg. That's an emergency. Here's the scary part. Hypertension is often called the silent killer because it usually has no obvious symptoms. You can feel perfectly fine while your arteries, heart, kidneys, and brain are under constant strain. Over time, this extra pressure damages your blood vessels. Imagine constantly inflating a balloon until the material gets weaker and thinner. That's exactly what happens inside your body. Complications include heart attack from blocked arteries, stroke from ruptured or clogged brain vessels, kidney failure because kidneys filter blood under pressure, vision loss from damaged retinal vessels, dementia and memory decline from reduced brain blood flow. According to the World Health Organization, hypertension is responsible for about 10.8 million deaths every year worldwide. That's more than any single disease risk factor. So what causes blood pressure to rise? There are two main types. Primary hypertension develops gradually with age, no single cause. Secondary hypertension, caused by conditions like kidney disease, thyroid problems, or certain medications. But there are many risk factors. Age, risk increases as you get older, genetics and family history, obesity and lack of exercise, high salt diet, too much sodium, excessive alcohol intake, smoking, chronic stress, sleep apnea. According to the CDC, African Americans in the U.S. have higher rates of hypertension compared to other ethnic groups, partly due to genetics and lifestyle factors. Since there are usually no symptoms, the only way to know if you have high blood pressure is to check it regularly. Doctors recommend adults aged 18 to 39 with normal BP and no risk factors check every 3 to 5 years. Adults 40 plus or with risk factors check every year. You can buy a reliable home monitor and track your pressure at home. Consistently high readings mean you should see a doctor. Here's the good news. Lifestyle changes can make a huge difference. In fact, the DASH diet, dietary approaches to stop hypertension, developed with NIH support, has been shown in multiple clinical trials to lower blood pressure within just 2 weeks. Key strategies: reduce sodium, aim for less than 1,500 to 2,300 milligrams per day. That's about 1 teaspoon of salt total. Eat more potassium. Bananas, sweet potatoes, beans, spinach. Potassium helps relax blood vessels. Follow the DASH diet. Fruits, vegetables, whole grains, lean protein, low-fat dairy. Exercise regularly, at least 150 minutes per week of moderate aerobic activity, like walking, cycling, swimming. Lose excess weight. Even losing 5 to 10 pounds can lower BP. Limit alcohol. Men, no more than 2 drinks per day. Women, 1 drink per day. Quit smoking. Smoking damages arteries, worsening BP. Manage stress, meditation, yoga, deep breathing. Get good sleep. Poor sleep raises BP risk. According to the American College of Cardiology, lifestyle changes alone can reduce systolic blood pressure by 10 to 15 mmHg, sometimes as much as a prescription drug. When lifestyle changes aren't enough, doctors may prescribe medication. Treatment is personalized. Many people need 2 or more medications to control hypertension. Having high blood pressure doesn't mean your life is over. It means you have to take control. Trap your numbers, make lifestyle changes, take your medications if prescribed, and work closely with your healthcare provider. Remember, every small change matters. Even a 5 millimeters reduction in systolic BP can lower your risk of heart attack and stroke significantly. So here's the takeaway. High blood pressure is common, dangerous, but controllable. Don't wait for symptoms. Get checked, take action, and protect your heart, brain, and future. If you found this video helpful, hit that like button, subscribe for more health tips, and share this video with someone you care about, because awareness can literally save lives.